It's been another deadly day in Victoria's fight against coronavirus. 9 people have lost their lives, including a man in his 60s. 7 of those people were in aged care. The overall number of new cases has fallen again, dropping below 300 for the first time in a week. But more than 800 of the state's active cases are in struggling aged care homes. Today, a specialist aged care response team stepped up its work to try to get on top of the emergency.
Jim Stafiri is dealing with the news that nobody with a loved one in aged care wants to hear. His mother, Louisa, has tested positive to COVID.
Things haven't been good for days, so she just needs to be taken out of here, taken to the hospital to give her the best chance.
His mother and others at Epping Gardens have been transferred to hospital after 2 people died and 83 cases were confirmed. Other homes being evacuated include St Basil's in Fawkner, where there have been 92 cases and 11 deaths, Kirkbrae in Kilsyth with 73 cases and 1 death, and Outlook Gardens in Dandenong North with 35 cases. Helen Anderson's mum has been removed from Outlook Gardens. She's relieved help has arrived.
I hope that no other families have to go through the agony that we've had to go through.
We are all very distressed by those events that took place in those few facilities.
Most of the 800 aged care cases are in privately run centres regulated by the Commonwealth. There had been plenty of warning about the risks, both overseas and in Sydney.
It is not unpredictable that, in fact, the infections have happened in the aged care homes. And the reality is that we've been caught short.
Emergency doctor Sarah Whitelaw says authorities should have used the past 5 months to prepare a proper response.
If we get to the point where we have to transfer wholesale all aged care residents from nursing homes out into the acute healthcare system, there will be a point in the not too distant future where we run out of capacity. We will run out of beds.
So many staff were infected at St Basil's that some residents were left to fend for themselves.
This was a new situation that had not been anticipated or foreshadowed.
Due to their condition, some of the elderly in hospital won't be in intensive care.
It's very tragic that it's gotten to a point where they are infected with coronavirus and they're requiring end-of-life care, but it's a tragic reality.
Simmering tension had threatened to boil over, with the blame game and background briefing in full swing. But to combat this unprecedented situation, unity is required. And while the Prime Minister may have referred to this as a Victorian wave, the focus is rightly on working together to stop the spread.
I think it's a bit of a storm in a teacup.
The only fight I'm engaged in is a fight against this deadly virus, and that will not change.
A reminder of the effort needed to stop this virus from spreading and taking lives. Richard William, ABC News, Melbourne.
The peak body for older Australians says it's disappointed that lessons haven't been learnt from the outbreak at Sydney's Newmarch House. 19 residents died over a 3-month period there. Today the government revealed that a report into what went wrong still hasn't been finished.
Anthony Bowe's mother, Patricia, has recovered after being struck down with coronavirus during the outbreak at Newmarch House. Watching events unfold in Victoria, there's a sense of déjà vu.
Frustrated, so frustrated that so many missed opportunities from what we learn out of Newmarch just hasn't been applied in any way, shape or form.
The government says the crisis in Victoria is on an entirely different scale.
We will see deaths every day, and that is a tragedy.
Providers around the country are watching with growing anxiety.
What we've seen happen in Victoria is a salutary lesson. We can't afford to look at Victoria and think this can't happen to us.
The federal opposition says it's a lesson that should have been learned.
The Newmarch issue was there for all to see in Sydney a while ago, and the federal government does need to get on top of this.
Back in May, the man in charge at Newmarch admitted mistakes had been made.
And with hindsight, I think if we had our time again, we'd be asking for positive patients to be sent to hospital.
The peak body for older people says it's disappointing to see some of the same errors being repeated.
Providers needed to have learnt that communication with families is absolutely critical. and they needed to have someone ready to do that if they have a COVID outbreak, and clearly in some cases that hasn't happened.
The Victorian Premier said yesterday he wouldn't want his mum in some of the care homes. It's a comment that's hit hard in the aged care sector, where the industry says workers are risking their lives on a daily basis to care for vulnerable residents. Ursula Malone, ABC News.